Hello and welcome. Today we're diving into a condition that can significantly impact your eye health: conjunctival xerosis. This dryness of the conjunctiva, the clear membrane covering the white part of your eye and the inside of your eyelids, can lead to discomfort and, if left untreated, more serious complications. Let's explore what causes it, how it affects your eyes, and what can be done about it. Conjunctival xerosis arises from a variety of underlying causes. The most common is vitamin A deficiency, especially in areas where malnutrition is prevalent. Vitamin A is crucial for maintaining healthy epithelial surfaces, including the conjunctiva. Other contributing factors include conditions that disrupt tear production, such as Sjogren's syndrome, Stevens-Johnson syndrome, and ocular cicatricial pemphigoid. These diseases damage the tear glands or the conjunctival surface, leading to dryness. Environmental factors like chronic exposure to dry air, wind, and dust can also exacerbate the condition. Certain medications can also reduce tear production as a side effect, contributing to the development of conjunctival xerosis. The pathophysiology of conjunctival xerosis centers around the disruption of the normal tear film and the conjunctival epithelium. Reduced tear production or abnormal tear composition leads to inadequate lubrication and protection of the conjunctival surface. This lack of moisture causes the conjunctival cells to dry out and become damaged. Prolonged dryness triggers a cascade of events, including inflammation, squamous metaplasia, where the normal conjunctival cells are replaced by cells that resemble skin, and keratinization, the formation of a hard, dry surface. These changes disrupt the conjunctiva's normal function, impairing its ability to protect the eye and maintain a smooth optical surface. The epidemiology of conjunctival xerosis varies significantly based on geographical location and socioeconomic factors. Vitamin A deficiency-related xerosis is most common in developing countries with limited access to nutritious foods. In these regions, it's often seen in young children and pregnant women. In developed countries, xerosis is more likely to be associated with autoimmune diseases like Sjogren's syndrome or age-related tear dysfunction. The prevalence also increases with age, as tear production naturally decreases over time. Occupations that involve prolonged computer use or exposure to dry environments also increase the risk. The signs and symptoms of conjunctival xerosis can range from mild irritation to significant visual impairment. Common symptoms include persistent dryness, a gritty or sandy feeling in the eyes, redness, itching, and burning sensations. Patients may also experience photophobia, or sensitivity to light, and excessive tearing, which is often a paradoxical response to the dryness. In severe cases, there may be visible changes to the conjunctiva, such as thickening, wrinkling, and the appearance of Betot spots, foamy, triangular patches caused by keratin buildup. Blurry vision is also common, especially after prolonged reading or screen time. Diagnosing conjunctival xerosis involves a thorough eye examination and a review of the patient's medical history. The doctor will assess the appearance of the conjunctiva, looking for signs of dryness, inflammation, and keratinization. Tear film evaluation tests, such as the Sturmer test, can measure tear production. Lissamine green or rose Bengal staining can highlight areas of damaged conjunctival cells. In some cases, a conjunctival biopsy may be necessary to confirm the diagnosis and rule out other conditions. A comprehensive medical history, including information about medications, diet, and systemic diseases, is crucial for identifying the underlying cause of the xerosis. Conjunctival xerosis can be classified based on its underlying cause and severity. We often distinguish between xerosis due to vitamin A deficiency and xerosis resulting from other conditions like autoimmune disorders or environmental factors. Regarding severity, it can be graded as mild, moderate, or severe, based on the extent of conjunctival involvement and the severity of symptoms. This classification helps guide treatment strategies and monitor the patient's response to therapy. The treatment and management of conjunctival xerosis focus on alleviating symptoms, addressing the underlying cause, and preventing complications. Artificial tears are the mainstay of treatment, providing lubrication and reducing discomfort. For vitamin A deficiency-related xerosis, vitamin A supplementation, either orally or through injections, is essential. If the xerosis is due to an autoimmune disease, immunosuppressants, or other disease-modifying medications may be necessary. Other treatments include topical corticosteroids to reduce inflammation, lubricating ointments for nighttime use, and punctal plugs to reduce tear drainage. In severe cases, surgical procedures such as conjunctival transplantation may be considered. Preventing conjunctival xerosis involves adopting healthy lifestyle habits and addressing modifiable risk factors. A balanced diet rich in vitamin A, found in foods like carrots, sweet potatoes, and leafy green vegetables, is crucial. Avoiding prolonged exposure to dry air, wind, and dust can also help. Using humidifiers to increase indoor humidity and wearing wraparound sunglasses to protect the eyes from the elements are beneficial. Individuals who use computers for extended periods should take frequent breaks and practice blinking exercises to maintain tear production. If you experience persistent dryness or irritation, consult an eye care professional for prompt diagnosis and treatment. The prognosis for conjunctival xerosis depends on the underlying cause and the timeliness of treatment. With appropriate management, many patients can achieve significant symptom relief and prevent long-term complications. Vitamin A deficiency-related xerosis can often be reversed with vitamin supplementation. However, xerosis due to autoimmune diseases may require ongoing management to control symptoms and prevent progression. Recent research focuses on developing new treatments for dry eye disease, including novel artificial tears, anti-inflammatory agents, and regenerative therapies. These advances hold promise for improving the long-term outlook for individuals with conjunctival xerosis.